This is chapter 38 from the Mahon microbiology textbook, and we will be discussing genital tract infections. Some definitions to know. STI is sexually transmitted infection, STD, sexually transmitted disease, and VD, venereal disease, after the goddess of love. For modes of transmission, these are genital tract infections are passed from intimate person-to-person sexual contact through vaginal intercourse, oral sex, anal sex, from mother to child during pregnancy or childbirth, and also through blood products or tissue transplant. So we're going to talk about some specific sexually transmitted infections, and we're going to start out with genital chlamydiosis. This is caused by Chlamydia trachomatis, which is an obligate intracellular bacterium. It's the most common bacterial sexually transmitted disease. The symptoms in men, they have urethritis and discharge. In females, usually asymptomatic, so it can progress to pelvic inflammatory disease. The lab diagnosis is done by nucleic acid probes because it is not culturable in the lab. For Neisseria gonorrhea, it causes gonorrhea. It infects the columnar epithelial cells of the genital tract. There's an incubation period of 2 to 7 days, and it can also spread in blood, producing rash on extremities and arthritis in the joints. And look at this bacteria. I love this picture. It shows the pili, the flagella, and the diplococci. In men, the gonorrhea symptoms are urethral inflammation with dysuria, pyuria, and urethral discharge. In women, it can be asymptomatic and also lead to pelvic inflammatory disease. It can be treated with cephalosporin antibiotics, also doxycycline. In the laboratory, we will typically see gram-negative diplococci that have a kidney bean shape. These are very small. The gram stain is significant in males, but not in females because females have so much other gram-negative flora. And we can identify these via the CTA sugars or other rapid kits. However, most often these are diagnosed using nucleic acid probes, and usually the gonorrhea chlamydia are done in a pair. Also, syphilis is still around, although there is a very good treatment now. Penicillin can be used to treat syphilis. Syphilis is caused by the spirochete Treponema pallidum. It has an incubation period of 1 to 90 days. The primary syphilis shows as a canker at the site of inoculation. It could also be a full body rash in the secondary phase, and it has the potential to affect the central nervous system in the tertiary phase. Also, it cannot be cultured, so we diagnose this by direct fluorescent antibody or serology testing, and we start out with the RPR test. For cancroid, I looked on the internet to show you pictures of this, but it was rough stuff, so I'm not going to show you a picture of cancroid. It is caused by Haemophilus ducreyi, seen in underdeveloped countries. The incubation period is 4 to 7 days, but the notable fact about cancroid or Haemophilus ducreyi is that on the gram stain, you will see a school of fish appearance. Genital herpes is the next STD that we're going to discuss. We have both herpes simplex virus 1 and 2. HSV1 traditionally caused fever blisters or cold sores, so above the waist, and HSV2 was usually the genital herpes type, but now they are flip-flop back and forth. The virus is shed even in the absence of symptoms. It can be transmitted by sexual contact with secretions from infected sites. The incubation period is 1 to 26 days after exposure. And in the lab, this is mostly done with molecular testing as well. All right, bacterial vaginitis or vaginosis can be caused by several different things. The signs are discharge, vaginal itching, and odor, and then there are also STDs that can be caused by bacterial vaginosis and trichomoniasis. So, what is bacterial vaginosis? Well, it's a loss of normal vaginal flora. So, you have an overgrowth of, or you lose your, not an overgrowth, you lose the lactobacillus. No, I'm sorry. There is an overgrowth of lactobacillus, these other bacteria, and Gardnerella vaginalis. They take over. So the pH increases, so it goes up, which means it's more basic, causing a fish-like odor. At the bedside, you can do a bedside diagnosis. The pH will be greater than 4.5. And the whiff test. That is the addition of potassium hydroxide, and then you smell for a fishy odor. I do not recommend this, and I have never seen this done, but it does exist. Also, for laboratory diagnosis of bacterial vaginosis, we can do a wet prep. And in the wet prep, we will be looking for clue cells, which are exfoliated epithelial cells covered with gram-variable rods or gram-negative rods, curved gram-negative rods. You will lack white blood cells, or there could be a few white blood cells, but there will be a presence of an odor, pH greater than 4.5, and on our culture, we will see no growth on blood agar plates, but the V agar will show as beta hemolytic colonies. Now, what I've seen in the lab is there may be some growth on blood agar, but these are very tiny, tiny colonies. We will also see Trichomonas vaginalis on a wet prep in the micro lab. We are looking for flagellated urogenital parasites. The patient's symptoms are itching, burning, yellow-green frothy discharge, and a foul-smelling odor. And again, we will be diagnosing this in the lab by the use of a wet prep. And we want to do a wet prep with saline, not KOH, because KOH will kill the Trichomonas organisms, and it's much easier to diagnose if we actually see these moving parasites, and you will see them, and it's great fun when we get these in the lab. HPV is also a common STD in individuals under 24 years old. These are associated with genital warts and many different types of cervical cancer, and we are going to be diagnosing these with a molecular test as well. HIV is another STD. I think we have, as a public health measure, mostly gotten this under control in the United States. Transmission is via sexual contact or exposure to blood or body fluids. The viruses attack the CD4 T helper cells, and that increases the potential for opportunistic pathogens. Symptoms include fever, tiredness, swollen lymph nodes, and a skin rash. And the diagnosis is done by a screening method first for the HIV-1 antibody, and then we do a confirmatory test with the Western blot or immunofluorescence. So what specimen types can we use for genital tract infections? Urethral discharge, cervical or vaginal swabs, throat swabs, anal swabs. Specimen collection is done with usually Dacron swabs are best. Isolation of gonococci can be need to be placed in Stewart's or Amy's with charcoal to prevent drying. We will run to culture those within 6 hours, and for viral culture, the swab gets placed in transport media. We will do direct exam or gram stains on male urethral discharge, but not women. And when we get these gram stains, we are going to look for intra and extracellular bacteria, also white blood cells and other cells. And then the wet mount, that's the same thing as the wet prep. It's performed on vaginal discharge, and we're going to look for clue cells, yeast, Trichomonas vaginalis, and white blood cells. Examples of media to include when you inoculate bacterial genital cultures is a blood agar plate for sure, McConkey to isolate the gram-negative rods, chocolate because you're looking for Neisseria, CNA to isolate the gram-positives, V-agar, Thayer-Martin, modified Thayer-Martin, or GC-lect, which is going to be specific or selective for gonorrhea, and then limb broth to help isolate group B strep if it is present. We're going to incubate all the cultures as usual at 35 degrees Celsius with CO2 for 18 to 24 hours. We want to quantitate and identify all the potential pathogens and send out a preliminary report at 24 hours and then hold all the plates for 72 hours. And this is a picture of Neisseria gonorrhea on Thayer-Martin. So here's a list of the pathogens that we talked about: Neisseria gonorrhea, Haemophilus ducreyi, Gardnerella vaginalis, Trichomonas vaginalis, beta hemolytic group B strep and A. We didn't really talk about this, but that's definitely a pathogen. Listeria, Staph aureus, if it's in predominant numbers. Candida or yeast species, if it's in predominant numbers. So these can be normal flora, staphs and streps, but if it's overtaking everything, then you know it's a problem. Gram-negative rods, if there is no normal flora. Also, what's normal flora in the genital tract? And this is the female genital tract. Lactobacillus, coagulase-negative staph, diphthroids, anaerobic cocci or rods, and Enterococcus species can all be normal flora. And that concludes our chapter on genital tract infections.